Welcome, future nurses, to LPN LaunchPad. The nursing process and clinical judgment are essential for nurses to deliver high quality, patient centered care. This presentation will explore how these frameworks enhance decision making and improve outcomes. The nursing process provides a systematic approach to care, meeting the patient's needs in an organized and effective manner. It includes 5 steps: assessment, diagnosis, planning, implementation, and evaluation. The assessment phase is the foundation of the nursing process. It involves collecting subjective data, such as the patient's description of symptoms, and objective data, including measurable findings like vital signs or lab results. Data sources can be primary, such as information directly from the patient, or secondary, such as family members, medical records, or other healthcare providers. Combining these sources ensures a comprehensive understanding of the patient's condition. During the diagnosis phase, the nurse identifies specific patient needs. There are 4 nursing diagnoses: actual, risk, health promotion, and syndrome. Each type helps guide the appropriate course of care. Each nursing diagnosis consists of 3 components: the problem statement, which describes the patient's issue, related factors, which highlight contributing conditions, and defining characteristics, which list observable signs and symptoms. Effective goal setting is a critical part of planning. Goals should follow the SMART framework, meaning they are specific, measurable, achievable, relevant, and time bound. SMART goals ensure that objectives are clear and actionable. Care planning prioritizes interventions based on Maslow's hierarchy of needs, with life threatening issues addressed first. This ensures that the care team meets the most urgent needs promptly. Interventions can be nurse prescribed, such as repositioning a patient, or provider prescribed, like administering medications. Both types are vital for achieving the goals outlined in the care plan. The first 3 steps, assessment, diagnosis, and planning, create a foundation for effective care. They provide a structured approach to addressing patient needs and preparing for implementation. During implementation, the nurse performs the care plan intervention safely and adjusts as needed based on patient responses. Collaboration with the healthcare team is critical during this phase. The evaluation phase compares the patient's actual outcomes with the expected goals. Failure to reach adequate outcomes means the care plan needs reassessment and adjustment. The nursing process is dynamic and adaptable, with each step informing the next. The nursing process ensures that care remains patient-centered and responsive to changing conditions. Clinical judgment complements the nursing process by incorporating critical thinking and contextual decision-making. This integration allows nurses to provide tailored, high-quality care. Recognizing cues is the first step in clinical judgment. Recognizing cues involves identifying subjective data, such as pain reports, and objective data, like changes in vital signs. Once cues are recognized, they must be analyzed and linked to clinical knowledge. This step involves identifying patterns and understanding the patient's condition. Develop hypotheses to explain the patient's condition. These potential explanations guide the nurse in planning appropriate interventions. Prioritizing hypotheses ensures that the nurse addresses life-threatening issues first. Nurses must evaluate which conditions require immediate action and which can wait until later. Taking action involves implementing the chosen interventions to address the highest priority issues. Collaboration with the healthcare team is essential during this phase. By integrating clinical judgment with the nursing process, nurses can provide comprehensive care that is adaptable to each patient's unique needs. Education, simulations, and reflection can help develop clinical judgment skills. Journaling and feedback from peers also help refine these skills. Common barriers to clinical judgment include time constraints, limited resources, and biases. Strategies to overcome these include using evidence-based guidelines and fostering teamwork. Technology supports clinical judgment through tools like electronic health records and AI-based systems. These tools enhance decision-making, but do not replace critical thinking. A holistic approach considers the patient's physical, emotional, social, and spiritual needs, ensuring that care addresses all aspects of well-being. Integrating research and clinical evidence into practice is critical for delivering high quality care. Evidence based practice leads to better interventions and patient outcomes. Engaging patients in their care aligns interventions with their values and preferences. This collaboration ensures effective and respectful care. Continuous learning through reflection and self assessment is essential for improving clinical judgment. Reviewing past cases helps refine decision making skills. Preparing for the NCLEX requires mastering the nursing process. Focus on the 5 steps: assessment, diagnosis, planning, implementation, and evaluation. Recognizing subjective and objective data is critical for identifying key patient needs and setting priorities. Clinical judgment is essential for success with the NCLEX. Use frameworks like Tanner's clinical judgment model, which includes recognizing cues, analyzing data, planning, acting, and evaluating. Prioritize patient needs using the ABCs: airway, breathing, and circulation, and Maslow's hierarchy of needs. Scenario: a nurse is assessing a patient with a history of heart failure. The patient reports shortness of breath. The nurse notes crackles in the lungs and 3+ pitting edema in the legs. Question: which step of the nursing process is the nurse performing? Options: A. Planning. B. Implementation. C. Evaluation. D. Assessment. The correct answer is D. Assessment. In this scenario, the nurse is gathering subjective data, such as shortness of breath, and objective data, like crackles in the lungs and pitting edema. Assessment is the first step of the nursing process, focusing on collecting data to guide care. Scenario: a postoperative patient reports severe pain at the surgical site. The nurse identifies this as an actual nursing diagnosis. Question: which component of the nursing process should the nurse address next? Options: A. Assessment. B. Goal setting. C. Implementation. D. Evaluation. The correct answer is B. Goal setting. After diagnosing the problem, the nurse's next step is establishing goals. For this scenario, the goal may be to reduce pain to an acceptable level within a specific time frame. Scenario: a patient is receiving IV antibiotics for pneumonia. The nurse notes a sudden increase in respiratory rate, oxygen saturation of 88%, and use of accessory muscles for breathing. Question: what is the nurse's priority intervention? Options: A. Notify the provider. B. Administer a prescribed bronchodilator. C. Reassess the patient in 15 minutes. D. Elevate the head of the bed and provide oxygen. The correct answer is D. Elevate the head of the bed and provide oxygen. The patient is showing signs of respiratory distress. The priority action is to improve oxygenation and ventilation before proceeding with further interventions. Scenario: a nurse notices subtle changes in a postoperative patient, including confusion and a slight drop in blood pressure. The nurse suspects hypovolemia. Question: which step of the clinical judgment process is the nurse performing? Options: A. Recognizing cues. B. Analyzing and interpreting data. C. Formulating hypotheses. D. Prioritizing hypotheses. The correct answer is A. Recognizing cues. The nurse identifies critical data, such as confusion and low blood pressure, that suggest potential complications. Recognizing cues is the first step in the clinical judgment process and forms the foundation for further decision making.
Hey there, this is Brian. I am the creator of LPN LaunchPad. I want to say thank you for learning with us. In addition to these videos, I've created a series of free adaptive quizzes in ChatGPT. The link to this video's quiz will be listed in the description below. Help me keep this project alive by hitting the like and subscribe buttons.